Well, it's hard to imagine a bigger, hotter issue right now than healthcare. Even before Congress tackled an ambitious and controversial reform effort, people of all political persuasions in Brevard County listed healthcare and its costs as a top issue for them. I'm Matt Reed, and joining us today is Lisa Gurri, CEO of Brevard Health Alliance. The organization offers primary healthcare services to people regardless of their ability to pay. Services including discount medications and clinics in Cocoa, Melbourne, and Palm Bay. Also joining me is Florida Today editorial page editor John Glish. John has been at the epicenter of public debate over healthcare reform. He has overseen readers' letters, the writing of columnists and bloggers, and has opined himself on the issues. Lisa, let's start with a little bit about your organization. Tell me why it exists and who do you serve?
Sure. Brevard Health Alliance is the federally qualified health center in Brevard County. We have a responsibility to provide affordable, accessible health care to those individuals that may have access barriers. And access is defined very broadly: transportation issues, cultural, linguistic, or uninsured.
What has demand been like in recent months compared to years past? Recession underway, more demand?
Absolutely. And I can tell you that if you look at our volumes of new patients from last year to this year, same period, we're up about 64% in terms of new patients seeking care for the first time.
Where do you get your money?
Our money is really a mix, and Brevard Health Alliance is unique in community health centers because we do have a tremendous amount of local funding. Our money comes, about 40% comes from the federal government through the Bureau of Primary Health Care, and another 35% comes from local funding through the hospitals and through the county commission.
What's in it for the hospitals? Why would they support a group like yours?
Well, I'll tell you a lot. Not only do we enjoy having all not-for-profit hospitals in this community, which is unique, but they take their mission very seriously. It's the right thing to do for the patients they serve. It's the right thing to do for providing business in a community, but it also has a return on investment in their healthcare costs. Individuals that seek care through the emergency room cost at least 150% more to receive that same level of care. And they don't necessarily receive appropriate care. Their needs are not met in the emergency room.
I want to ask both of you this. There's obviously a major national debate underway on healthcare reform. What reforms, if any, do you think would best serve Brevard County? Are there drop deads that your group has been advocating? Or?
Yeah, I think from where we sit, there are a couple of things that we see are necessary to continue to expand our mission and reach those that are underinsured. I think, first of all, that we have to have affordable, accessible health care. The health care needs to be delivered in the communities, and the staff that deliver that health care needs to be representative of the patients that seek the care. If there's a lot of Spanish in that community, you need to have that reflected in your staff so that you can meet their ethical premises. I think the other is, call it what you want, but there's got to be some level of tort reform. We cannot continue to afford to practice defensive medicine. We've got to be able to order the diagnostic tests that are appropriate for the disease that are trying to be diagnosed. I think the other is there has to be equal access across the systems for both seniors, for children, for the disabled.
John, is this debate that we're having, is it really about changing people's relationships with doctors and what they do, or is this more about changing the health insurance and payment system?
It's really about a lot of things, and I think the best way that I can describe it is there was this great old science fiction movie from the 1950s that was called The Beast from 10,000 Fathoms, maybe you remember it, where you had this monster come up with all these tentacles and it was reaching after everybody and everything. That's what this debate is like, and it has gotten that raucous. But I think if you look at the numbers that we're talking about on healthcare in America, the system that we have now is clearly broken to the point that it's not functioning, and the costs are unsustainable. We've got 47 million Americans right now without health insurance, and nearly 4 million of those are in Florida. A couple other numbers: more than 3,500 Floridians are losing or dropping their health care insurance every week because they're either losing their jobs through layoffs in the recession, or they just simply cannot afford to pay their premium payments anymore. Here's a couple other things to chew on. If you have a plan through your employer, the average family premium between 1999 and 2000 jumped almost 120% from about $5,800 per family to almost $12,700. That's about almost 4 times faster than your wages are going up. Congressional Budget Office has projected that annual health care costs will rise to $13,000 a person, not a family, a person, by the year 2017. That's only what, 9 years from now, 8-9 years from now, and that the number of uninsured could reach 54 million people. Recent studies have also shown that about 62% of all bankruptcies in this country in 2007 were caused in large part by catastrophic health care costs. The situation it cannot continue. It cannot continue for the average working individual and the working family. It cannot continue because of the extreme cost burden it's putting on businesses, and it cannot continue to go on because of the federal government. By 2019, in 10 years, Medicare is going to go bust unless something is figured out. So it is absolutely essential that out of this fierce debate that's going out, some type of significant reform takes place.
Why do you two suppose there hasn't been some kind of revolt over healthcare costs or healthcare insurance costs? When hurricane insurance costs went up, you had people packing town halls and realtors marching in the street. When every year the Florida Chamber of Commerce has on its agenda for Tallahassee some rollback of workers' comp insurance because that's crushing business. When medical malpractice insurance premiums are going up, due primarily to a lack of competition among providers, doctors were marching and picketing in Tallahassee. Today, people are packing town halls, but they're saying, don't touch my health insurance. What's going on there?
From my perspective, and from the individuals that we see every day in our clinic, the people that are uninsured or disenfranchised don't have a voice. It's the individuals who have good insurance that don't want it to change.
Your take, John?
Politically, it's also a lot about the lobby in Washington and the amount of money that they're pouring in, largely the insurance companies, the pharmaceutical industry, the huge dollars that they give to the politicians in Congress and for campaign contributions and the pressure that puts on them. A very good example is the Senate Finance Committee, which is still working on a bill that many think might be the best shot at a legitimate bipartisan compromise. The leader of that committee is Senator Max Baucus. He's a Democrat from Montana. He's taken almost $4 million in contributions from the healthcare industry. That's a tremendous amount of influence that they have on him. Senator Grassley, one of the ranking minority members, Republicans in that committee, has taken over $2 million. When politicians are getting that kind of money, they listen to what they're hearing from the people who give them the money, and they're not listening to the average hardworking American who is finding themselves in the situation where they can't afford, they either don't have insurance, they cannot afford the escalating premiums, and businesses as well, again, that are just being overburdened by this.
Lisa, what are the biggest differences in the actual health of people who are poor or living in some of our low-income neighborhoods in Brevard County compared to the people who might be watching this at home who have okay to very good health care insurance and providers and maybe middle class?
Well, I would say their health status really isn't that much different. There are particular health disparities that are unique to Brevard just because of the nature of the environment we live in, like there's a high incidence of skin cancer, but that crosses the spectrum of economics. I think the difference between the people that come to us is the health care maybe that they receive, and if I could speak to that for a minute.
Yeah.
You talked about the tremendous pressure that's on in Washington with pharmaceutical companies and such. Putting that all aside, and let me tell you a little bit about what happens when you come to Brevard Health Alliance. We enjoy a couple of things that neutralize what you're talking about. We enjoy the Federal Tort Claims Act, and that means that our physicians can practice medicine in a non-defensive fashion. The substitute defendant in any case involving a patient that's in a federally qualified health center is the U.S. Department of Justice. The second thing that happens is we enjoy 340B drug pricing. So we can purchase pharmaceuticals at the same price as the VA. It's about 32% of wholesale. And the other thing that happens is that we are required by the federal government to be located in communities where the individuals that we serve reside. And we also are required to provide health care plans and quality data back to the federal government on what we're doing to change health care, including preventative care. Now, if you put that all together, what does that mean? It means that an individual that enters our system enters a very different system. It truly encompasses what is called a medical home, and you've heard that thrown around
Sure.
at the federal level. And we can deliver that same care at 32% less than traditional medical office.
Does your group do outreach as well to teach people about their options for health care in some of these communities where you work?
Well, one of the successes of community health centers, Brevard Health Alliance specifically, is that we do reach out to the community. We reach out to those individuals that are not doing preventative health. So you know at some point chronic disease is going to crop up, or individuals that have chronic diseases and are only going to the emergency room once or twice a year. Those individuals need to be brought within a medical home.
The reason I asked is that I received a 10-page list of warnings this week from a group called the Liberty Council over in Maitland. And they are steadfastly against any federal spending. I believe you received some federal
Yes.
spending on any groups that go into poor neighborhoods to teach poor people about their health care options, because that money might go to Acorn. Are you Acorn? Have you ever heard of Acorn?
No, we have a responsibility to reach out to individuals that don't have health care.
One of the other issues that came up in the town hall debates was the issue of whether or not federally subsidized health care would help illegal immigrants. Does your group screen for illegal immigrants, or
Absolutely.
do you take care of everybody? Or?
We take care of everybody. And we liken it to, these are individuals that live in our community, whether they're insured or not. They're individuals that ride on the buses. They're the individuals that work in the restaurants that we all eat in. They are the individuals that that their children go to school with our children. And they need access to health care because it's a good thing for all of us.
John, what do you make of some of the issues and the complaints that are being raised right now about the reform efforts in Washington?
Well, I think certainly anytime you're looking at change on this kind of level, it brings a lot of concern, uncertainty, and people get downright scared. But what's also been going on is just a massive propaganda campaign fueled by just flat out lies on some of the key points of some of the reform proposals that have been coming out. The big one, of course, was this whole nonsensical idea that there would be death panels that would euthanize your grandmother, when the provision that was in the proposed bill would actually talk about kind of like long-term end-of-life issues. Make sure you have a living will. What kind of care would you want? Do you want to get chemo till the very, very end, or do you want to say no at some point and just go through hospice and pass on quietly? That we did this with my mother. The irony of that issue is that provision that was put in the bill wasn't put in by President Obama. It wasn't put in by someone in the White House. It wasn't put in by some liberal Democrat. It was written by U.S. Senator Johnny Isakson, who's a Republican and a very conservative Republican from Georgia, who recently just said that this whole idea, anyone who believes this, is nuts. This is the kind of very destructive stuff that's going on in the debate. A very strong and healthy debate is needed, and there are a lot of things to be concerned about. I mean, editorially, we have said on our page that we think change, meaningful reform has to happen this year. All Americans have to be covered, have to have access to affordable health care, and this has to be crafted in a way that does not increase the federal budget deficit. So within those broad parameters, there's a lot of room for debate, but not just the inflammatory lies and the fear-mongering and so on that's been going on. It does nothing to solve the problem that is so very real and getting more real to more people every day.
Lisa, are there, from your perspective, what are some of the legitimate beefs or problems that you see maybe coming down in the package of reforms? Are there any that you see that you don't like?
It changes daily, as you know.
Right.
Sometimes 3 or 4 times a day.
Right. I just think it's important that we do have healthy debate on all of the issues. I think it's important that we ensure that we look at cost, we look at accessibility, and we look at affordability very, very clearly.
Let's talk about the Health Alliance a little bit more. What are you not doing now? What are the unmet needs that you think you would like to be tending to as a group?
Well, capacity is an issue, and it will continue to be an issue for us. We began as an organization in 2005 with 0 patients. We have 27,000 registered patients, but we know that there's 150,000 individuals in Brevard County that have access issues. Either they're uninsured or they have Medicaid and don't have access to primary care. So just doing the math, you can see that we've made a huge dent in it, but we're only, 20% up the line in terms of meeting all the needs. And there are people every day that are saying the same things, John, that you said. I just had to make a decision to drop my insurance. I'd like to try to get my child on the Florida Kid Care because I can't have the family plan at work anymore. They've cut my hours to 32 hours, and now I don't have benefits available to me. In our Central County clinic, something that we see every single day are individuals that have been insured all their life, worked in the aerospace industry in Titusville, and are for the first time navigating a system they know nothing about to receive their health care. They've had good health care all their life, and they want to continue that.
I didn't even think of that, but
Sure.
there's always a tie back to shuttle jobs in some way or
Yeah.
another, but that's going to create a big issue.
If I can add something to what Lisa just said, just because too, and this is important context in this whole debate, just because you have a job now with a company that provides you health care, I do, you do, because we work here in Florida today, does not mean that that's going to be that way necessarily down the road, because the costs are becoming so prohibitive and so burdensome to businesses that more businesses are dropping the insurance packages that they have, which kicks more people out of the system into doors like yours. Personally, I do not think how any person can call themselves a real fiscal conservative and pro-business and care about the average working man and woman in this country and their family and the wages they make without agreeing that this system has to be reformed in a real significant and meaningful way. I just don't see it. This has to happen.
I think a lot of times we forget, though, also that the healthcare industry is an industry, and that those are real jobs, and that those people make their livings based on reimbursements as well, and that when those shuttle jobs go away, there are probably doctors and clinics and offices up in the north part of the county that are going to see their revenue and income go down as well. So is that kind of how you see it?
Absolutely. There's no guarantees from day to day, and the numbers are growing, and the stories are more and more compelling every day.
What's your annual budget? About 1.8 million? Is that what I saw?
Those are the federal dollars that we receive.
Okay.
Those are the federal dollars. We have about a $6 million budget, with about 40% coming from local funding sources.
How many people work for you?
We have 12
Full-time?
providers, 12
Okay.
providers, and we employ about 80 individuals in the community.
John, what are we not bringing up today that you think is one of the we need to be paying attention to in the next month, year down the road?
Well, I think what you're going to see in the next month now as we head into September and through September when Congress comes back from its August recess is that there's some type of critical mass that is going to happen one way or the other on this issue in Washington. From where I sit today, I don't know how that's necessarily going to fall out, but it's going to happen then. And I'd also just want to add that I think organizations such as Brevard Health Alliance and Lisa and her folks, they just perform an invaluable, literally a life-saving service in this community. And they're seeing more and more of us Brevardians walk in their door every day. The world that we the economic world that we live in, any one of us here or anyone who's watching this show could very well find themselves picking up the phone or going to the website and walking in their door, because that's just the harsh reality of the way things are economically with the recession and just, again, the very broken system we have of healthcare in this country.
Well, that's our program. I want to thank my guests here today. And Lisa, thank you for coming in and sharing your ideas with us. John, thanks for joining us here.
Always nice to be here.
We'll see you next Wednesday right here on WBCC and Florida.com. I'm your host, Matt Reed. We'll see you then.